So we'll turn it over to Jack.
Hi, this is Jack Westfall. Uh, really happy to be here, honored to be here and presenting these data. You can go to the next slide. Or do I have control of this?
It's me.
Okay, so this is a presentation that I'm doing for another organization, the North American Primary Care Research Group. This data was selected as a distinguished paper. I put this together, then I traveled for 3 weeks, just got back yesterday and didn't have time to adjust it. So you get to see the whole thing, but I'm not going to go through the whole thing. It's going to be a little quicker. What we're trying to look at is using an exemplar zip code to look at the healthcare services obtained by people within a geographic location compared to the care that they receive in other parts of the state to see if we can maximize local care delivery. We used 80759 because that's my hometown. It's the place where I work clinically at the Yuma Hospital and Clinic in Yuma, Colorado. Very excited to be able to share these data with you. Next. Next, you can go past the land acknowledgement, and you know the map of rural Colorado and critical access hospitals. You can go to the next one. So this is what we're trying to look at. So all the healthcare services delivered in 80759 is that middle circle. So these are services that are specifically located within this zip code. But then people who live in that zip code may access services in other parts of the state. That's the big circle. So that tells you all the services necessary in a given year for people living in a geographic area. And then the little circle is healthcare services delivered within 80759 to people who aren't residents of 80759. They come in from a neighboring community or a neighboring county where they're visiting. This really will help us identify the care that a community needs and help a hospital or a healthcare system identify what of those services they can most likely deliver locally versus what needs to be done elsewhere. Next. This is the context. You can go to the next one. So we wanted to describe the breadth and volume of healthcare services, and we sought to answer the three following questions. What services were accessed by patients living in one community? Where are those services obtained? And who provides clinical services to those patients? Number three, we're not quite there yet. We're still cleaning the data to identify the level of provider who's delivering the services, but we did get sort of the what and the where. Next. So this is Yuma. This is the zip code 80759 out on Highway 34 and Highway 59, for those of you who don't know where it is. Next. That's a little picture of Yuma and the grain elevators. Next. We used the all payer claims data for 5 years using ICD-10, CPT, E&M codes, and the same zip code by patient and delivery site. Residents of Colorado zip code, there's about 4,600 people that live in that zip code. And then again, the services delivered there and the services obtained elsewhere. Next. Oh, a couple more pictures of Yuma. Next. Okay, so there were about 5,294 residents of 80759 received care over a 5-year period. There is some movement in and out with a stable population of about 4,600. There are about 600 more people that come in and out during the time period. 3,300 of those people received some care, at least a little bit of care in 80759, but 1,900 received no care in 80759, but got some care outside of 80759. So there is a large population who never get medical care within their own zip code. Now, one caveat to this is the radiology that we do at the Yuma Hospital is read by a Nighthawk service elsewhere. And so while the radiology is done in that zip code, it is read in another zip code. So that's where the most of the billing comes from. And so the radiology data are a little bit sketch. So next. So here's what we have. Here's a little heat plot of what kind of services they get. You can see office visits are a big chunk, radiologic exams, psychological and psychiatric services, hospitalization, and then you get down to the smaller services, nursing homes, cataract surgery. Some of these you can't even read, echocardiography, dialysis. So this is sort of the breadth of services obtained by people living in 80759. Next. Next. So each year there are about 18,000 services for patients living in zip code 80759, 6,500 office visits, 1,100 hospitalizations, 1,500 radiologic exams, 700 ER visits, et cetera, et cetera. You can see as we get smaller and smaller, about 40 deliveries done for people who are living in 80759. Next. However, you'll see in that first, you'll see in the next heat map, let's just go to that one. So here we have these broken out by where they got the services. So office visits, about half of the office visits were obtained in 80759. But as I said, radiologic exams, while we do a lot of radiologic exams in 80759, they're read elsewhere. And so the billing data comes from a different zip code. Hospitalizations, you can see a number of people are hospitalized within 80759, but it's a small portion of people hospitalized. Next. ER visits. The majority of people who go to the ER who live in 80759 get that ER care locally. That's what we would expect. They live there. They're in an emergency. Where are they going to get care? They get it locally. Next. Physical therapy. We do most of the physical therapy locally. We have very good PTOT department, so most of the people getting physical therapy get it there locally. Next. Dialysis. Guess what? Yuma 80759 does not have a dialysis unit. So we don't do any dialysis. None of the dialysis done for people living in 80759 is done locally, nor are the deliveries. The next smaller circle down there in the lower right. We don't do any deliveries locally. So you can see there's a broad array of variation in the services that are delivered locally versus services that are done elsewhere. Next. Oh, we talked about this. Next. So this got us thinking, well, what are the services that we're not ever going to do? And what are the services that we already do a little of that we might be able to capture more of the market share? So we're never going to do open heart surgery, right? Yuma's not going to do that. I'm not going to do that. So that's probably not a place to expand services. But in the medicine specialties, that purple, the purple piece of pie with the dark blue in the middle, medicine specialties, the vast majority of medicine specialty visits are done outside the zip code, but some are done locally. Why not try to make that dark blue piece of pie a little bit bigger? Same with orthopedics, the purple piece of pie, the dark purple. We do some orthopedics. We do hips and knees and shoulder. We do a lot of surgery, but we could potentially capture more of that. We already have the facilities set up for that. Same with general surgery. We have facilities to do general surgery, but we're not capturing a big piece of that market. So this is going to help our hospital administrator and our hospital team think about what are the services that none of these are done at the Yuma Hospital, and what do we already have? What would we have to build from scratch? What do we just need to grow? Next. This just says what I just said. You can go on. And then I have a series of slides, and I think I'm about out of time, so I won't go through these too much. This is, again, all the care provided within 80759. This is all the stuff we do. You won't find obstetrics and deliveries on here. This is care delivered in 80759. And then we were wondering about our market in the surrounding communities. So how much of the care that's provided in 80759 is for the surrounding community. So next slide. This is all other zip codes. So the dark is people within our zip code, but we provide a substantial amount of care to people who live in other zip codes. Our catchment area is much bigger than 80759. Next. Here's the next town over, Otis, where I was born, 80743. You can see we provide a substantial amount of care there. What this figure does not show is what proportion of care to people who live in Otis is delivered in 80759. And that will be our next piece to say, for the people who live in 80743, how much of their care is delivered in 80759? Could we capture more of that? It's 13 miles away. Could we capture more of that? Next. Here's Akron, another small town in eastern Colorado. These are the top 5 catchment areas for zip codes. Next. Ray is a small town 27 miles to the east, but they have a very large healthcare system. They have a surgeon and an orthopedist and a very stable primary care service. So we don't get a lot of care from 80758, a little bit, but not too much. Next. So here's the sort of crux of that. Are there ways to expand healthcare services within 80759 in areas that we're already delivering those services? And how might we capture more of the people who live in those surrounding zip codes into our facility so they don't have to travel to the Denver, the Front Range area? Specifically thinking about primary care, specialty care, orthopedic surgery, general surgery. These analyses have led us to hire a new ophthalmologist to do cataracts because we weren't capturing any cataracts, but we're now able to do cataract surgery in Yuma, and that's helping us deliver those services locally. Next. I think that's it. Next. And next. Thank you very much. And I'm happy to take questions, or I'm happy to have my email in the chat, and I would love to talk with anybody. Our goal is to do this as a pilot in 80759, a place where, because I live there, I have lived there, I work there, we can test the fidelity and the veracity of these numbers. Is this really what's going on? Because I work there. And then we're hoping to be able to do this in dozens of other zip codes to help healthcare facilities identify places for growth and places for expansion. Thank you.